I'm Dr. Jerry Hesch, a physical therapist from the Hesch Institute in Aurora, Colorado. And this presentation is on cuboid syndrome. And the question is, do we need a cuboid whip, which is a maneuver done from the bottom of the foot, or do we need a cuboid plunge, which is resetting the cuboid inferiorly? Now the cuboid moves with the calcaneus because it has a very strong attachment to the calcaneus. And so whichever way the calcaneus goes, so must the cuboid. The cuboid also articulates with the cuneiform, and the cuneiform is largely controlled by the navicula. This is the navicula on the medial arch of the foot. This is head of the talus. These are cuneiforms, and what's between my thumbs is the navicula, which mostly rotates. So when you raise your arch, it rotates outward, and when you drop your arch, it rotates downward. It moves along with the three cuneiforms. The cuneiforms are like blocks. They're rather flat planar joints. And so they primarily move up or down or glide medially or laterally. It's very rare for a cuneiform bone to lose its mobility. I have a recollection of one time that I had to mobilize the medial cuneiform. However, the midfoot does lose pronation in someone who has an injury causing a rigidity of the foot, which raises the arch. This is called a SuperNatori pattern. And of course it involves the entire foot, not just the midfoot. But that can be tested by clasping, bringing your thumb down the tibia onto the head of the talus, and then pinching that which is in front of it, and that's the navicula. And you can grab navicula and the rest of the midfoot and rotate it medial and laterally. And if it's really tight at the end feel of going medially, but it has free outward mobility, then that is an externally rotated navicular or midfoot, or supinated midfoot. And again, let me flip the foot around, the cuneiform follows those movements. Okay? So if a person has an injury that causes a rigid foot, then part of that pattern is raising of the arch, and the cuboid tends to rotate up and outward, laterally, up and laterally. And so for those persons, you want to restore medial rotation to the midfoot, especially the navicula, and you also want to restore medial and downward rotation. So that's when you want to do what is a cuboid plunge. And I favor doing 30 reps of this maneuver. Now the other type of injury we'll talk about in a while, but I need to come back and say that part of that pattern in a rigid injury, an injury that causes a rigid fixation, a SuperNatori pattern in the foot and ankle with raising of the arch, also involves the joint where the calcaneus or the heel joins the bottom of the talus. Very complicated joint, and what the heel tends to do is it tends to invert. And it also rotates, the front of it rotates medially. So what it loses is it loses this outward motion, this lateral eversion, and it loses this outward rotation called abduction. And so when treating the cuboid, you need to concern yourself not only with what's happening at the midfoot, but also what is happening at the calcaneus. And in that pattern, I typically treat by distracting the calcaneus inferiorly, blocking the talus through the lateral and medial malleolus, pinching that, dragging the calcaneus downward, and then working on restoring rotation outward, also called abduction. So you always need to think more than just the cuboid. So now let's focus a little bit more on someone in which they had a pronatory injury where the foot flattened and the cuboid became jammed medially. Those are the folks in which you want to restore the lateral arch. You want to do a inferior to superior mobilization, which is called a cuboid whip. Now this is the only one that's made it into the literature. If you read the very few articles on cuboid syndrome, they all talk about a cuboid whip. They don't talk about that opposite pattern that I spoke about. So the cuboid whip is performed by plantar flexing the foot, and you can feel that big tubercle on the cuboid. It's quite pronounced. And you take up the slack in the structure and bam, you give it a quick little thrust. And oftentimes it does make a sound. And that's the technique for a medially rotated and dropped cuboid. Now, I've been blessed to have both types of dysfunction. Quite some time ago, I had the supinated foot, rigid foot from an injury, and I required the mobilization of the midfoot, mobilization of the calcaneus, and also the plunge, the medial rotation and downward drop of the cuboid. And that resolved, and it resolved for decades. About a year ago or so, I have no idea what was the cause, but I developed the opposite, in which the cuboid whipped outward. I mean, who knows? Maybe it was walking the dog and I, just minimally twisted it. I really have no idea. But anyway, I apparently had an injury in which the stress exceeded the constraints of the ligaments, and the cuboid dropped downward and medially and was stuck there, and it was very painful. And I tried treating it myself, trying to whip it superiorly, bottom up and outward. And the pain persisted, and so I ended up stacking 2 arch pads. These are pads made for the medial arch, but nonetheless, I cut them and put them out here to give a vertical force to the cuboid. And I wore that for several days, maybe as much as a week, maybe a little longer. I don't really recall, but it worked. By the time the pad started getting loose in the shoe insert, I took them off and I was pain-free, and I've been pain-free ever since. So I hope that this is an instructive video. I have another model of the foot and ankle with all the complexity of ligaments and tendons, and it gives you an appreciation for how strong that joint is, and it does take a large external force to cause that to get stuck. But anyway, multiple structures to work through to get mobility of that structure. But I hope I've been clear in my presentation in making a case for when we want to mobilize the cuboid medially and inferiorly, which I call a cuboid plunge, and always mobilizing the rest of the midfoot with that maneuver, and always restoring distraction and abduction, external rotation, and restoring eversion to the calcaneus. And I hope I've made a case for the opposite of that, when an injury causes the cuboid to get stuck medially and inferiorly, in which you need to do a cuboid whip going from the bottom to the top, whipping it up and out with the foot in a position of plantar flexion. I hope that's helpful to you, and thank you very much.